very small capillaries, a spider web around your muscle fibers. Oxygen is delivered, diffuses from the capillaries into the mitochondria where oxygen is used to regenerate ATP for muscle contraction. Whatever oxygen is left over and a whole lot of carbon dioxide now goes back up the other way. So the very small capillaries, the small venules, the larger veins, and then the largest vein of the body. What's the largest vein of the body? The vena cava. We go through the bottom or the inferior side, then it goes up to the top, the superior side, and we dump it into the right side of the heart, the right atrium. From the right atrium we go down into the right ventricle we go to the lungs, then we go to the left atrium to the left ventricle, and we start that circuit all over again. How cool is that? So say we have, just picking a number, say we have 100 milliliters of oxygen going to the muscles in the arterial circulation, and 20 milliliters of oxygen coming back to the venous side, to the right side of the heart. 100 going, 20 coming back. What's the VO2 difference then? 8. Very good. Okay. So you want to have a high stroke volume, a high heart rate, and a wide or large VO2 difference. Because the larger that VO2 difference, then that means the more oxygen has been extracted by the muscles, and that's a good thing. Okay? So we've already talked about this morning that if you multiply stroke volume times heart rate, you get cardiac output. And cardiac output is the volume of blood leaving the left ventricle of the heart per minute, because you get your stroke volume multiplied by your heart rate. So VO2, the volume of oxygen consumed, equals cardiac output times the arteriovenous oxygen content difference. Does that make sense? So the left side of the equation is referred to as central or cardiac